the heart and soul behind every business. Stories. Welcome to Business Story of the Week, hosted by me, Joshua Laurie. From setbacks to comebacks, from tragedies to triumphs, we inspire entrepreneurs through conversations that matter. Witness the magic that turns dreams into reality. Whether it's your career, business, or life, your success is always one story away. This is Business Story of the Week.
Hi, this is Kari, Carter-Cherelus, and you're tuning into the Business Story of the Week.
Fantastic. And that is Kari herself, the lovely Kari Carter-Cherelus, and she will be our guest for today. And my name is Joshua. I am your host. Every day, every week, every episode, we ask you a question. And today's question is burnout the hidden epidemic in the healthcare industry? Well, Kari is the perfect guest to answer that question for us today. Kari Carter-Cherelus is a dental hygienist turned public speaker, author, and consultant. After experiencing burnout in a toxic work environment, she now helps professionals prevent and manage burnout. As the founder of KMC Strategic Solutions, Kari empowers others through her dynamic presentations on burnout, diversity, empowerment, and workplace issues. She is also an advocate for mental health and has written the Ultimate Guide for Dental Hygienist Burnout, offering strategies for an optimal dental hygiene career. And today, Kari is going to be sharing all of that with us, her insight, her experience. Kari, thank you so much for coming on the show. How are you doing?
I'm doing good. Thank you for having me. I appreciate being on the show.
You had a real quick answer to that opening question just now. What would that be? Was it the hidden epidemic? Would you even call it a hidden epidemic?
I don't think it's hidden. I think that mainly due to the pandemic, the veil has been taken off. So it's something that we've dealt with forever. However, we just kept, I think, plugging along. And then with the pandemic, it really highlighted that healthcare, especially all industries deal with burnout, but especially healthcare has really highlighted the issue. And everyone's talking about it. You see it on the news, especially during the pandemic, the news, internet, everyone is really dealing with it. And that's why it's a shortage of professionals throughout industries, but especially healthcare.
It's like you said, the veil has been lifted, but I feel like also the amount of burnout has doubled. It feels like the stress has doubled. It's funny because it feels like we're still reeling from that, which is half a decade ago, and we're experiencing all of this. Like you said, the veil has been lifted. We haven't gone through, we've been going through it, but now it's become very apparent. Kari, before we truly start getting into it, I always like to ask about the origin. I want to know the origin story of Kari. What was a young Kari Carter like? Did she always dream about being a dentist? What would the young Kari say to the Kari of today?
Well, the young Carrie did not always dream of being a dental hygienist. In fact, it really depended on what movies I was watching. So I wanted to be an astronaut when I love space, so I love sci-fi. I wanted to be an astronaut and go in space. I begged to go to space camp like every year. Because I thought maybe from one movie I watched, I thought maybe I would get into space somehow on an accident that way. I wanted to be an archaeologist because of watching Indiana Jones. So it really depended on movies. I love movies, but no, I didn't think that I didn't initially want to be a dental hygienist, but I always did like helping people. And that's what a dental hygienist does, is help patients to get to overall health and wellness.
Wow, it sounds like you've always been curious, but you've always been like a dream chaser, so to speak. You've always wanted to go after your dreams. What was the pivotal moment? What was the turning point for you where, okay, I'm going to be a dental hygienist. This is going to be my career. And did you always love it? Was it always a passion of yours?
My mom really introduced becoming a dental hygienist because I always did like teeth. I was always brushing my teeth. I always liked going to the dentist, actually. So she thought that maybe that would be a good career choice. When I decided my senior year of high school, I wasn't going to be an environmental engineer. So I was kind of like, what am I going to do? And then she offered that. And after researching it, I thought it would be my personality fit the career, and I did like it. I didn't always like my career. I think many of us have highs and lows in our career.
Mm,
So I really love helping patients, developing those patient relationships, helping patients get to better health. But I didn't always like some of the environments that I was in as a hygienist. So
interesting.
unfortunately, sometimes you're not always getting along with your team members or
Mhm.
your employer, or you don't like the work conditions or the hours and things. There were some different challenges and are some different challenges that dental professionals experience inside the field. And eventually that did lead to my own burnout that I actually
I see.
experienced, where I kind of felt broken, overwhelmed. And it's not that I didn't like the career anymore. I just really didn't like the toxic environment that I was in. It wasn't serving me.
Absolutely. And I always tell that to my friends too. And it's something that I also experienced, which is like, I mean, I love podcasting. I love what I do, but sometimes the number of shows gets to you, the pressure gets to you, the anxiety gets to you. And I always tell my friends and my family, and I'll tell them that just because you love something doesn't mean you won't experience burnout. It is actually possible. It's just a matter of managing that and hopefully persevering and being persistent about it. Carrie, talk to us a little bit about that. Talk to us about the elements, the environment surrounding the burnout when it comes to not just the dental industry, also the healthcare industry at large. You said that the veil has been lifted, it has always been there. What are the most contributing factors when it comes to healthcare burnout?
Well, I think one of the things with healthcare is that we're servicing patients. And these patients have a hard time getting off work to get service, you know.
I see.
So
Of course.
initially, the hours for dentistry were maybe between 8 and 5 and Fridays off. Now, those hours are extended to accommodate patients and to help with access to care. So people have barriers to care because of not being able to get off work. But now providers, clinicians can't necessarily get off work either because we're seeing patients. And so we're having a hard time with work life balance and being able to see our family. So that's a big thing. Lack of boundaries, that's in most jobs at times where, there's not a lot of boundaries or people just keep dumping work on you and you may be afraid to exert boundaries because you may feel like you're going to lose that job or people are going to get passive
Definitely.
aggressive. Some of the other issues is not always having the tools needed provided by your employer to do a really good job, or not knowing the expectations that your employer has. There's
Right.
so many different things, but in my case, a lot of times I was bullied. I didn't always have the resources needed. I didn't always advocate for myself. And so I think that those are some of the issues that workers experience, and that we may be more timid, especially if we need that job. We have bills to pay. And right now there's a shortage, but throughout my career, there wasn't always a shortage. Sometimes
Mm-hmm.
you're almost begging for a job,
Mm-hmm.
you're accepting maybe less than you should be getting, especially sometimes if it's discriminatory at times. There's a diversity issue within the industry. So I don't always look like the profile of what they think a hygienist should look like. And so you're trying to get your foot in the door doing the most and sometimes not getting the pay you want. So those are some of the factors that people have experienced that have led to the burnout. Doing so much work to prove you deserve to be there and then just, not feeling supported at times.
I mean, how you put it together in such a simple manner because everyone is relatable because people experience the same things that you go through in industries as well, but particularly in the healthcare industry is so prevalent because I feel like it's two huge factors. One is the environment, also is because a lot of people in the healthcare industry give so much of themselves to their patients, right? It's just it's natural. You want to be able to take care of your patient. Which factor do you think was a more contributing factor to the burnout? Do you feel like it's just a matter of like you're giving too much as a healthcare worker, or you know the environment that needs to be changed quickly? Which one do you think is a more
I think
contributing
it really
factor?
just I think it really depends on the person. So within the
Mm,
last couple years, the Surgeon General did a report on burnout with healthcare workers. So there's a whole big report that was done by the government concerning this and how to help this problem and how it's all industries, as was mentioned in the study. But basically, it's the things we're talking about is the workload, is patient care. We get a lot of times as healthcare providers, we give a lot to our patients.
Yes.
We are talking to our patients. When's the last time you've gone to the doctor? When's the last time you had your teeth cleaned? But secret is, although we're like, you need to go every 6 months or you need to floss, we're not necessarily doing the same things ourselves because we're giving ourselves to you all day long and everything. And sometimes we're wearing a mask. So I always say we wear a figurative mask. So we're keeping ourselves and you safe, but we're also kind of hiding our own emotions. So we have to deal with patients yelling at us because maybe their insurance doesn't cover a copay and they need a particular procedure. We have to deal with patients who have different abilities or disabilities and things. So yes, we're giving of ourselves a lot to our patients, and then we go home drained. And then often we're still caregivers and have to give care to our patients. So our families. So that contributes to the burnout that we have because all throughout that day, we're caregivers to someone and then we never really kind of replenish ourselves. So our cup keeps draining. We don't have a full cup because we're constantly giving it to someone else. And one thing I always say, it's like in the airplane, how we're supposed to put our mask on first. And generally, we're putting our mask on everybody else and then wondering why we can't breathe.
That's it. 2 words: self-care. And I think that's what we really, we forget. We tend to forget that a lot of time. Everywhere we are, in fact, even without, just a business owner, just an entrepreneur, we tend to just give all our hours into it. We're expected to hustle. We're expected to just put everything in it. And we just forget to fill our cups. Like you said, we keep draining our cups. It's just the expected norm, and we keep burning out, and it's just not sustainable. Kari, I understand that this is now what you talk about. This is what you teach, and you talk about burnout in the healthcare industry and how to manage it better, how to come up with an optimal dental hygiene career. That is literally the title of your book. I love it, by the way. This is my question. I want a bit of a quirky question on this one that allow us to talk about it more. If managing burnout was like maintaining oral health,
Mm.
what would be the daily flossing and what would be regular checkups? And this is how we can manage our burnout. So I want an analogy when it comes to oral health. Talk to us about that.
Okay, so basically, every day we have bacteria that's building up in our mouth and trying to destroy us in some type of way. So it's going to cause steam breath or possible cavities if we don't get rid of it. And so, like you said, self care is something that we should do daily. If we don't do it daily, and it doesn't mean you have to go on vacation or massage, it could just be like breathing in and out for a couple times a day, just mindfulness or journaling. So, something that doesn't take a lot of time because frankly, we don't usually have it, but we are giving something back to ourselves and everything. So that will be that daily care that we're doing. We know we need the brush. That's the basic care, hopefully. And then interdental flossing, using a water pick. That's how you get into ourselves. So we have to also focus on our internal locus of control. What can we control? We can't control our patient load usually all the time, or how patients are going to act that particular day, or
Mm.
something's going to happen. Something always happens. When I go speak, at times there's always a tech issue. I have to bring a million cords and a million different adapters because something may happen. Be prepared for something to happen. So we can't always control what's going to happen, but we can control ourselves and how we're going to kind of try to react to it. So that's something that we should do. So things are going to happen every once in a while, despite our best efforts. We may get a cavity, or we may need crack our tooth and need a crown. Sometimes life happens, but daily care can really reduce the risk of something like that happening.
Wow, daily care, daily self-care is very, very important. You've highlighted it once again. You need to fill your cup, and you need to feel. I love how you said mindfulness, taking that time, doing it for yourself. Carry any other personal favorites of self-care that you do for yourself other than mindfulness. Maybe, you take a bite of that favorite chocolate of yours. What would be your personal favorite?
I think right now, because I'm a business owner, so I work with several companies and I also have my own business. What helps me, because I always say I'm always in recovery. It's kind of like someone who, is trying to live a life of sobriety. Because I have the personality that leads towards burnout, I have to make sure that I'm doing what I need to avoid it or to manage it. So what's helped me as a business owner is having a team. So I'm a solopreneur, but I
All right.
have a team. So, and that's hard sometimes as a solopreneur because you're like, I got to make payroll. Let me try to do everything myself. But when you try to do everything yourself, then you're taking away time from your family or you're adding stress to yourself. So delegating tasks is very important so that you have people who are going to help you. So even if the listeners aren't entrepreneurs, having a supportive network is important. So what is your support network? What is your friends? Do you have a therapist? So making sure that you have a supportive network that's gonna check in with you and tell you when you're acting a little crazy or you need to practice self-care or go sit
Right.
down is very important.
Maybe slow down a little bit. Have someone tell you to like conflict. You need a break. I'm seeing it, I'm feeling it, but that's very important. I love that you highlighted that because it's not just about having a team to delegate tasks to, it's also having a support network to check in on you sometime. As a business owner, like you said, as a business owner, I love that because of course our audience and listeners relate to that as well. Sometimes we question that it takes more time to delegate than it is to just do it myself. But really, I think the results always speaks for itself that it's just much quicker to delegate, trusting others as well. And even if you can do it yourself better, it's better for your mental health to just ask for help, basically.
Basically, I mean, burnout is in everything. So right now I have a course that I'll be doing shortly about mommy burnout and talking
Wow.
to different people and how a lot of females feel regarding burnout. I have a young son and having conversations with my husband regarding what I need, how I need help around the house. And so letting go when like he's helping fold the clothes and I'm looking at them, he's folded them. They're not folded like I would have folded them, like you said, so sometimes our team doesn't do it like how we would do it, but it's done. And so letting it go that it's not exactly how maybe we would have done it, but we at least have that help that we need. The task is fine, it's done. We have to almost just let go and stop being so perfectionist. And sometimes our personality leads to that burnout because we want things to be a certain way. And when it's not a certain way, it frazzles us.
I love that. Of course, Carrie, you have your own podcast where you talk about all of this. It's called Burnout Bite. Can we find it on any platform? And of course, where else can we find you and where else can we find your course?
So you can find it on a number of platforms. It is on Apple, it's on Spotify, I think it's on Amazon. On the RSS feed, basically you click on that and you'll see it everywhere. You can find me on all social media platforms. Instagram, I'm KMC Smiles. LinkedIn is Kari Carter-Cherelus. Facebook, Kari Carter-Cherelus. And then as far as my courses, usually I post them on all my different platforms. Webinar is going to be in October. The sponsor hasn't put it up yet, but basically you can always connect with me through that or through my email address.
Fantastic. Of course, you can also invite Carrie. She is speaking on a lot of events to talk about burnout. Carrie, we'd love to book you. Should we just find you on your socials as well? If our audience and listeners would love to have you.
Yes, because I'm so busy. I'm still working on my website. So SharellaSmiles@gmail.com or my link is bit.ly
Mhm.
Burnout Dental Hygienist. So yes, I love speaking. I speak for all different industries, spoken international. So I'm pretty busy speaking either in person or virtually. And I love speaking for all different organizations, companies, and schools.
I love that you found also this shift in your career where you get to help a lot more, the same way that you could also help, that you were helping people in your dental career as well. Carrie, I love the insight. I love that we get to talk about burnout. I love actually talking about burnout on the show because it's an epidemic. Not just in the healthcare industry, it's everywhere. We need to really start taking care of ourselves because rest is also productive. Carrie, one last bit of wisdom that you would love to leave behind the audience. What would this be? Take us home.
I would like the listeners to know that they are not alone. So initially, I didn't even know what burnout really was. I just knew I didn't like my job. I didn't like how I felt. At
Mhm.
times, I felt stressed. I felt broken. I didn't feel supported. But it's a known epidemic, like you basically are saying. A lot of people are experiencing it. There's a lot of information out there about it. So know that you're not alone. Get a supportive network, talk about it, get a therapist if needed. And then I always encourage people to work on it. So start aligning yourself with the life that you like to live. You can't always just leave your job and quit your job. It may not even just be job related. It may be some different
Yes.
changes that you need to take in your life to align yourself more with the life that you want to live. So see what you need to do, self-evaluate your situation, and then make those needed changes. And sometimes you need a coach or counselor, a therapist, or a trusted friend to really help you to see what you need to do that, to get out of burnout, to manage it.
Absolutely. And who best to reach out to than Carrie herself and to help you manage all of that? Ladies and gentlemen, go check out Carrie. We'll make sure to put the links on down there. Go check her out on her socials. Go go check out the upcoming webinar that she talked about also if you're a mom experiencing burnout. If you are a business owner, dental hygienist experiencing burnout, Carrie is the person to find. Carrie is the person to connect with. Carrie, thank you so much for coming on the show.
Thank you so much for having me. I definitely appreciate it.
To all our audience listeners out there, I hope you guys enjoyed this episode, and we will see you on the next one. Bye bye.
All right, so here's the thing. We try to get a little bit better every day, but we can't do it without you. So if you like the video, make sure to like and subscribe below. And if you have any comments, just leave them in the space under.